Good afternoon and welcome to Bariatric Friday. My name is Kemal Erkan. Bariatric Friday is the only weekly healthcare show in Delaware, perhaps in the entire United States. Of course, when we discuss healthcare, we must have a clinical expert, and that's why Dr. Irgau, Dr. Isaias Irgau is always with us, and we are going to discuss bariatric, morbid obesity, and patients who are struggling with these issues. And our approach is taking these in smaller pieces and smaller topics, and then we discuss different topics each week. And today we are going to discuss what to expect after bariatric surgery. And that's why Dr. Irgau is going to help us. So Dr. Irgau, how are you doing?
I'm doing great, Kemal. Always very happy to be back on Bariatric Friday and, again, assess and elaborate on another important aspect of bariatric surgery that is of interest to our patients.
Thank you. So now we are discussing this in a way that everyone can understand. Our patients can really get the support that they need. And a lot of issues that we see is understanding what they are going through. But I think some topics, they are a little bit more difficult than the others. But when we are looking for the most efficient way to deal with morbid obesity, things after bariatric surgery are things that we are looking forward to. So tell us what those things are, what to expect, and how we can prep our patients for what's coming up and how their life is going to change.
Absolutely, Kemal. So, of course, the biggest expectation is the weight loss, and that happens, and it will happen. I had office hours this morning, and I saw one of our patients who's about 6 months out, and she could not stop repeating, "Oh, you don't know how great I feel," And she kept saying that several times. She started at a weight of about 320 before surgery, and today's weight was 196 pounds, which is 6 months after the surgery. She did have a major event, socially in the family about 3 to 4 months before surgery, and she was filmed. There was a video of her then. And for a number of reasons, they were not able to really see the video until a couple of months ago. And both herself and her family could not recognize her. Really, she was extraordinarily happy. So the weight loss obviously is the major event, is the main reason we do the surgery. And associated with the weight loss, there is tremendous improvement in the health profile of the person, whether it's improvement of type 2 diabetes, improvement in high blood pressure, sleep apnea, and many other illnesses that are associated with morbid obesity. But as you said, it's also important for us to inform of our patients of many other aspects that may change in their life after bariatric surgery. And to that extent, probably it's helpful if we talk about early after surgery, midway, and then long term. What are the things that probably are not discussed as frequently? So first of all, very early after surgery, within the first, few hours to the first few days after surgery, one of the concerns many patients will have is, how much pain will I have? Will there be a lot of discomfort? And the important thing to mention here, Kemal, as you know, is as part of our bariatric center at the American Surgery Center, we have really implemented a protocol, a setup really that allows really minimum discomfort after surgery by preparing our patients even before the surgery with certain medications that will minimize really the pain itself after surgery. And as you have seen it yourself, 2 hours or an hour and a half after surgery, you see our patients walking the hallways of the surgery center, and you have to be reasonably comfortable to be able to do that. So we're not saying there is no pain, but the pain should be mild, or if it's moderate, it should be manageable with mild pain medications. Essentially, that's the expectation for most people. And the vast majority of people will not need pain medications beyond the first 2-3 days after the surgery, and certainly no major narcotic pain medications are used after surgery. And the surgery, as we always say, is done laparoscopically. So the actual cuts on the skin, the incisions, are actually very small incisions that tend to heal very quickly and with minimal discomfort for the vast majority of patients.
Now,
another thing that comes up is...
I'm so sorry.
Yeah, go
Going
ahead.
back to your patient earlier, this patient lost 40 pounds, 40% of her initial weight.
Yeah.
So can we actually talk about this a little bit more? And
Absolutely.
I have
Absolutely.
a small technical issue here, and if you see me doing things, it's because I'm trying to fix something here.
You're the presenter and the technician.
All right. Sorry, go ahead.
Yeah, absolutely. So essentially, it is extraordinary what, bariatric surgery can do in terms of really confronting this major problem, which is morbid obesity. And as we've said many times, and that's the reason we say that, is currently really the most effective treatment we have for morbid obesity is bariatric surgery. And, I was asking the patient, hey, do you have any challenges, any problems? She said, well, I have one regret. And I said, what's that? And she said, oh, I wish I had done this 10 years ago. She's in her late 30s now, and she wished she'd had done this in her 20s rather than struggle all these years with morbid obesity. And she has been, up and down with the weight many times, but she was very happy with that.
Well, in terms of what to expect, Dr. Ergau, if we can actually perhaps talk about the follow-up care a little bit, because that's the key for success. And although our patients are, in some cases, they may be a little bit overwhelmed with so many appointments they have, but now when you lose 40% of your total body weight, that's a big responsibility. It becomes a big responsibility to maintain and know how to deal with this new life. So can you actually talk about the follow-up care a little bit and see how...
Absolutely. So the follow-up is critical, both in the short term and in the long term. Definitely in the short term, it's very important because we want to make sure our patients are recovering well from the surgery. In the early days and early weeks after surgery, we are focused to make sure that there are no major complications with the surgery. And if patients are not progressing the way they are, we will certainly want to know about that. And one of the best ways to ensure that is to have a scheduled follow-up process, which we have in our practice. As you know, as soon as the patients are discharged, the next day, the surgery center calls the patients to find out how they're doing. And then at 2 weeks, patients have an appointment with our office. And then again at 1 month. And then after that, at the 3 months mark, and then every 3 months after that as well. And this support is very important. As I said earlier on, we want to make sure that recovery is happening without any hindrance. And we want a patient to tell us if they're having any unusual symptoms that may indicate that they may be having a complication. Fortunately, complications are extremely rare, but this is the best way really to be able to address them, is that patients are that they follow appropriately and that the follow-up is done in a timely fashion as well. And then in the long term, as you said, it's not a question of only losing the weight, but it's also maintaining that weight loss as well. As we talk very often with our patients, bariatric surgery is a powerful tool, and a tool nevertheless. The actual biology that drives that relentless journey of our body to really gain weight all the time is not really taken away with bariatric surgery. So patients have always have to be on their guard really about maintaining a healthy eating habit as well as regular physical activity for them to be able to stay healthy in the long term. And in that process, the follow-up is important because that creates accountability, but also any issues that may arise that could potentially sabotage this can be addressed if the follow-up is done in a timely fashion as well. So follow-up is very important, and part of the process that we have set up in our center, as you know, because you set it up yourself, is to have a database that allows for us to really trace our patients and continuously communicate with them if the follow-up is not done in an appropriate fashion.
Absolutely. And Dr. Erkan, most of our patients, they do have different comorbidities as like different illnesses, chronic illnesses. They may have diabetes, they may have hypertension. In terms of medication that patients are taking, what type of changes are we expecting them after this significant weight loss they have?
Absolutely. So again, great points. I was having office hours today. One of the patients had a very high A1C before surgery, and the A1C is normalized now. Another patient was telling me that soon after surgery, actually they were feeling dizzy, especially as they got up. And that is really a sign that their blood pressure was going down. And my first question was, what blood pressure medications are you taking? And the patient was continuing to take their blood pressure medication, but as their weight loss occurred, their blood pressure was normalizing. So if they were continuing to take blood pressure medication, now the normal blood pressure was going low, and that's how. So one of the things we instruct patients is to make sure they follow up with their primary care doctor very early after bariatric surgery, so appropriate adjustments can be made to their medication. So if they were diabetic, now they may require less medication or no medication at all. Similarly, if they had high blood pressure and they were on a number of medications to try to control that blood pressure, which was very high before surgery, now that they're losing weight and the morbid obesity is being addressed properly, blood pressure will lower down. And so they may need either less medication or no medication at all. So those are very, very important issues right after surgery that have to be addressed. And one of the reasons why we need to have this close follow-up schedule as well, because we can address these things that happen differently from individual to individual.
So nutrition is another part of the next life, I guess, the new life. So what should we be careful for nutrition? What is it that we have to do so that we don't have multivitamin issues or malnutrition issues? And do we have to follow up with a nutritionist, or do you advise that to the patients?
Absolutely. So that's a very important aspect of the changes after surgery, right? First of all, there is actually a definite progression in terms of the diet right after surgery. Our patients are instructed to be on a liquid diet for the first 2 weeks after surgery. And then after that, they go on to what we call a pureed diet until they are about 4 weeks after surgery. And then after the 4 weeks mark, they can start introducing chewable food. So the main point here is the consistency of the food. The first 2 weeks, they're just going to be on a liquid diet, which would mean just drinkable things, nothing else, right? And then after that, they can introduce more substantive food, but again, they cannot have anything that requires chewing. So one of the best way to explain to patients is to tell them that they have to pretend as if they have no teeth, right? So anything that's going to go into their mouths will have to be something they don't require to chew. It can be swallowed as it is, just like baby food consistency, right? And there is a very important reason for doing that, and that is because the surgery itself has led to certain wounds on the stomach or the intestine, depending on the type of surgery, that require healing. And if the patients introduce chewable food early, that can actually create injuries to the healing organs that could lead to complications. So it's very important for patients to really stick to this schedule. Now, another thing that is important that it's not talked about very often is that this surgery itself, actually, at least in the first few months after surgery, introduces some changes in the way patients actually appreciate taste and smell, to the extent that certain things that they loved before surgery, they may not care for now, or certain things that they didn't like before surgery may be much more palatable now. So those changes are transient. They are very much expected. So patients should not be surprised by that. It happens. Very often you will actually find patients not being able to go to the kitchen because the smell of food really turns them off, just because their sense of smell is so much more heightened. That really doesn't last very long, but that can create some nausea and sometimes even some apprehension. But that is temporary and it will pass. That is something that surprises patients if they were not prepared to know about that. And then as they introduce chewable food, as you said, they have to see a nutritionist as part of the follow-up for them to be reminded about the type of healthy food that they need to keep on eating in the long term, or they need to keep introducing as they are eating chewable food. Another thing that is important for patients to understand, Kemal, is now depending on the type of surgery they've had. For instance, if we take the sleeve gastrectomy, which is by far the most common surgery that we do right now, whereby we make the stomach a lot smaller. So the stomach that was large and compliant and accommodating, now it's more tubular. It looks like a banana, but also it's much tighter. It doesn't give in very easily, which means that as they are swallowing, there may be pressure that builds up in that stomach that backs into the food pipe. So when they're swallowing now, they may be more aware of this function, right? Before surgery, as you're swallowing, you're not aware of that passage of the food down your food pipe. But after surgery, you may be aware, and particularly if you're eating more than what you're supposed to eat, you may feel it as discomfort. And that is something that patients need to be aware and expect. Obviously, there is a fair amount of trial and error as they learn about this, as they start to become conscious about not going beyond that extra bite that may cause discomfort as they're eating, and they, acclimatize themselves gradually to eating just enough so that they don't have discomfort when they're swallowing. Another thing that is commonly, seen but not talked about is that patients may feel actually constipation very early after surgery as well. And that is something that has a variety of reasons. The fact that their diet obviously is so drastically changed early after surgery, the anesthesia itself, the medication, all that in the surgery itself can conspire to create really slowing down of the activity of the bowel. So constipation could be an issue, and it is okay for patients to take stool softeners or even laxatives as the days go by to just make sure that they make their activity regular until the normal rhythm returns.
There was a question before, actually, a couple of weeks ago during our case conference. It came from one of the patients if they could take Metamucil, and that was okay for them to do that.
Absolutely. So absolutely.
Now some of the complications we have a specific session for that. We discussed both on the short-term and long-term complications, but today we are focusing on the new life, new expectations. So how are we going to adapt to this new life, right? So
absolutely.
The fitness is another one. What should we expect from the fitness standpoint? What do we advise to the patients for the fitness?
So very important. So one of the common questions that patients ask us is, when can I start exercising? And the answer to that is immediately, right? As soon as they are awake and recover from anesthesia, we want our patients to move, right? So exercise starts with movement. The foundation of all exercise is walking. So patients have to walk very early after surgery. Now that's important really to get their body to make sure that they don't that they become active, but it's also very important for them to avoid potential complications, right? So if you're up and about and walk frequently, then issues like potentially blood clots or pneumonia, respiratory problems, those are much less likely to happen. So we encourage walking very early. Now, of course, their energy level, particularly right after surgery, in the first few days after surgery, is not going to be as high as it used to be. They will feel tiredness. We understand that. But what we say is you rest when you feel tired, but don't stay lying or sitting all the time. We want you to get up and frequently walk. Now, as they recover from the surgery and their energy level comes back, we want them to have scheduled exercise programs. And there are obviously exercises that have to wait until they're about 4 weeks after the surgery. And these are exercises generally that require engagement of the core abdominal muscles. So lifting heavy weights, doing crunches, planks, all those things will have to wait until they're about 4 weeks after surgery. But other exercises that involve really their legs, whether it's walking briskly, a stationary bike, elliptical, treadmill, all those are absolutely fine. And the intensity can be increased gradually as the time passes. After the 4 weeks, they can engage in any type of exercise, but it makes common sense really to understand that, any exercise that they haven't done since the surgery, they need to start it from the lower level of intensity and build gradually so that they can, get used to it without having to hurt themselves. So
fitness, though, it's the simplest thing that we can do, which is in some cases the most efficient one again, is walking.
Absolutely.
And then when you're walking, make sure you have this, if you, whatever type of phone you have on the iPhone, you can actually do the health application. It keeps both your walking, your steps.
Absolutely. Absolutely.
Right. And you can actually attach other stuff into this, but knowing how much you walk, and this shouldn't be actually, Dr. I was going to tell you the other day, this walk shouldn't be our, what we are looking for shouldn't be what we normally do without any effort, meaning that if you are getting up from your bed to the kitchen or kitchen to the car or car to the office, those try not to capture them if possible. Like what we should be looking for is the actual effort on the activity, meaning that you are really going out and walking. And then that shouldn't be that doesn't have to be too long. And if you do 20-minute sessions, that gives you more than 2 miles.
Absolutely.
And it's a great exercise, not just for the maintaining the weight loss, but also for circulation, for any type of other chronic illnesses that comes with. It's the best exercise, and it's the least costly. And even right now, we always have excuses, right? So we always find excuses. So as a human being, we are best on finding excuses why I won't do X, Y, Z. But there are no reason for these types of excuses, because if it's too hot, you go to the mall. If you go to one of the big food shopping places, grocery shopping, and they are just go through each aisle, and I promise you, you'll get 2 to 3 miles. Try not to buy anything. So if it's too cold, you can do the same thing. But invest in your life too. If those are the challenges, and if this becomes a problem because you are not able to find a place, then the gym memberships are inexpensive. And it's least costly, and you can always find some treadmill there. If it's too hot or if it's too cold. But walking is a key, and also recording it. Make sure that you have it on your phone, so you can see. It also motivates, and as you can see, I have mine. It does motivate us. It gives us an idea of how we are doing, how we are feeling. So it doesn't have to be any heavy exercise, as long as.
Absolutely. I agree with that, Kemal. So it's essentially what we're saying is that exercise should not be something where you're sweating all the time and you have to be doing something for hours. Not at all. The foundation of exercise is walking, right? So if you do frequent walking and you're doing it every day, the trade-off is that you're not sitting down during those minutes, right? So because you cannot sit and walk at the same time, every time you're walking is a time in which you're not sitting. So we're transforming a sedentary life to an active life just by the act of walking, essentially. So that has tremendous importance. And to add also to the importance of tracking their steps, Kemal, is that it gives you an opportunity really to tweak your life so that you can add more walking to your day if you see that you're getting short. Ideally, we want about 7,000 steps a day, which is about 2 to 3 miles on average, Kemal, right? But not everybody can do that all the time. And it doesn't have to happen immediately, but it's a goal, right? So if people track it, they can work towards that goal. And certainly that kind of activity, if it's done on a consistent level, will add to the health of the person greatly, as opposed to rushing to do exercise, maybe just do it for about a few weeks and then giving up and return to a sedentary life. That doesn't help at all.
So the other part of this new life, Dr. is sleeping issues and also stress. If you can address those two as well.
Absolutely, absolutely. So, they're all tied up essentially. So we do know that morbid obesity is also related to sleeping disorders in many levels, and sleep apnea being one of them essentially. But as people lose weight, actually, they will find that their sleep is better. They do sleep a lot better for a number of reasons. Now, conversely, if you sleep better, you're actually going to aid your weight loss as well. In other words, not having enough or good sleep by itself can interfere with weight loss. So we want our patients to have a healthy sleeping habits, essentially. And those habits can be definitely disturbed if patients are having stress and anxiety and other things, and sometimes there is not very much you can do about that, just because we live in a country that fills our days with very many stressful events. But understanding the importance of it and how important it is to have a healthy sleep is a beginning of it, essentially. So not eating late, for instance, or not, eating or drinking things that may disturb the person's sleep. If they have sleep apnea, utilizing their CPAP machine on a consistent level, all those things are very important. Now, as I said earlier on, the energy level may be fairly low, and patients actually may feel very sleepy at the beginning, in the first few days after surgery. But after that, they will feel a lot better, and adding, times of exercise as, their energy level builds up, that should also aid in them having, good sleeping nights as well.
And, when you feel like you don't have enough support, then what we have is first Tuesday of every month, we have a support group meeting. And also we have a Facebook support group, which you can find it on CHRIAS or ASC website. So as long as you stay in the topic, you stay focused on topic and don't talk about other not related issues, there are good discussions in the Facebook group as well. And then every second and fourth Tuesday, we have full bariatric webinar. I call them full webinar because they are not dividing the topics the way that we do. And then every Friday, there's a bariatric Friday. So there's really no excuse for us to kind of not find the proper resource, because we're always here. Now, we are also always here because we do daily case conferences for our patients. We are pretty hands-on, and I wouldn't say pretty, we are very hands-on, so that at least we know that until the surgery is done and right after surgery, there's a huge amount of support. And then we have a system in place that will keep you in the maintaining track, so then you'll be able to, as long as you don't have any abnormalities, any complications, those should keep you in track, on track. So then you'll be able to enjoy this patient earlier that we discussed, from 320 pounds to 190 pounds. That's 120 pounds weight loss. 4% of her weight. That's amazing. It is
amazing.
When we all struggle to lose 10, 15 pounds here and there, we take 40% of this person's entire weight down. Like, that's amazing. So, we are going to be here again next week with a different topic. In the meantime, these videos are available on our YouTube channel, on our playlists. There are specific playlists, so you can always go and watch those. In fact, you should definitely watch them, because we are sharing a lot of information that's extremely essential for those who are going through the surgery. And again, this is the only channel, healthcare channel out there that covers this issue on a weekly basis. So, thank you so much for joining us.
Thank you, Kemal.
And we'll be back. Thank you. Bye-bye.
Thank you. Have a nice weekend, everybody. Bye.